Hello everyone, my name is Jeanette Galvin. I will be doing my presentation on ADHD and adolescence and the risk factors of using non-prescription drugs. Adolescence is a stage of life that is connecting childhood and adulthood. This stage of life could be considered starting at the age of 10 up until 19 years old, as stated by the World Health Organization. Children going through adolescence go through multiple changes in all aspects of their lives. Not only are they going through puberty as a physical change, they are also trying to find ways to start finding their own identity as they adapt to family or home life, school life, and social or recreational aspects of their routine. According to the National Institute of Mental Health, ADHD is an acronym that stands for Attention Deficit Hyperactivity Disorder. It is considered having a developmental disorder that happens to have at least one or multiple symptoms, including having trouble staying focused, having issues staying on a task, moving around too much, speaking in an excessive manner, or interfering on everyone else. The Centers for Disease Control and Prevention retrieved data and statistics on ADHD as of November 2024 and stated that according to their data gathered, 1 in 9 children in the United States is diagnosed with ADHD. That is 11.4% of the population and equivalent to 7.1 million of the United States population. To get a better understanding of how prevalent ADHD is in adolescents, the CDC also obtained data of 3 types of treatments for ADHD. This is categorized and grouped into varying ages from 3 to 17-year-old. Those currently taking ADHD medication, those who received behavioral treatment for ADHD in the past 12 months, and those who received behavioral treatment for ADHD or any treatment or counseling from a mental health provider the last 12 months. Overall, those currently taking ADHD medication are at 53.6%. Children aged 3 to 5 years old are at 23.6%. 6 to 11-year-olds are at 56.9%, and 12 to 17-year-olds are at 53.4%. Those who have received behavioral treatment for ADHD in the past 12 months overall are at 44.4%. Aged 3 to 5 years old are at 51.5%. 6 to 11 years old are at 48.2%. And those 12 to 17-year-old are at 41%. In the last 12 months, those have received any treatment or counseling with a mental health provider are at an overall percentage of 58.3%. Ages 3 to 5 years old are at 57.4%. 6 to 11-year-olds are at 60%, and 12 to 17-year-olds are at 57.1%. This poses the question, what does this mean for the U.S. population of adolescents taking multiple forms of treatment, and why does this affect us? There are risk factors of these adolescent children and teens who use these prescription drugs, as they also have a tendency of using other non-prescription drugs such as alcohol, tobacco, marijuana, and nicotine. Before I discuss the risk factors, let's talk about brain development and how the brain of an adolescent differs from that of an adult. The prefrontal cortex deals with making decisions and processing reasons. With teenagers, because the brain isn't fully developed yet, they are prone to high-risk behaviors. The parietal lobe is responsible for awareness and senses of such as pressure, vibration, pain, and temperature. Teenagers do not process information effectively or as efficiently as that of an adult. The ventral striatum is considered as the reward pathway. Teens are more excited by rewards rather than consequences, therefore leading to behaviors they feel it more rewarding to themselves rather than considering the consequences of their actions. The basal ganglia controls behavior, movement, and learning. The reticular activation system controls and maintains sleep and wake cycles and also partially corresponds to stress responses. The two parts of the limbic system I'll discuss are the amygdala and the hippocampus. The amygdala is responsible for emotions. This is a major part of the behavioral and learning systems and the ability to understand and clarify others. The hippocampus deals with the memory and ability to make decisions. Now that we have gone over some parts of the brain and the development in adolescence, I'll cover two main neurotransmitters that act as a chemical messenger to signal multiple things. This deals with the brain development of an adolescent and the effects of ADHD medication. The first is dopamine. Dopamine is a chemical messenger in the brain that deals with motivation, reward, and movement. When a person is on ADHD medication, dopamine levels rise, which can allow movement and motivation. The second is norepinephrine. It's another chemical messenger in the brain that assists with duties such as maintaining specific feelings like excitement and danger and serves as a place that saves and recalls our memories. A person taking ADHD medication can be affected by the person's limbic system, which is the amygdala and the hippocampus specifically, that deals with the focused attention and prevention of being preoccupied. ADHD medication does affect sleep cycle. One of the most common drugs for ADHD that's prescribed is called methylphenidate, also known as MPH. There are adverse side effects to this medication. It can disrupt one's sleep cycle. One can wake up in the middle of the night, have inadequate sleep, and have difficulty going back to sleep. The National Sleep Foundation states that teenagers need 8 to 10 hours of sleep every night. If one does not get enough sleep, cortisol and adrenaline levels rise, which will make one feel stressed and on edge. This will affect performances at school, making one feel overwhelmed and even more tired. Inadequate sleep also leads to not being able to recall things, leading to decrease in memory and responses. Becoming irritable can lead to conflicts within peers, at school, and family members at home. As mentioned before, because teenagers do not have a complete sense of identity yet, they can lean towards using alcohol or drugs to fit in with their peers. According to the Child Mind Institute, children with ADHD are more prone to abuse drugs and alcohol for the simple reason of making them feel calm and to take a break from their ADHD symptoms as they experience racing thoughts, impulsivity, and hyperactivity. In 2019, the Society for Adolescent Health and Medicine brought together research that conducted 23.4% of children between the ages of 12 to 17 did not properly use prescription stimulants. ADHD medication can be classified as a stimulant. Most of these were taken from someone who had a prescription for them and sold, gave them away, or traded their medications. In addition, 2/3 of high school seniors that took prescription stimulants were also taking other drugs such as marijuana or alcohol. There are risk factors associated with substance abuse. According to the same research from the Substance Abuse and Mental Health Services Administration, an individual could impact their mental health and create lower performance in academics, their relationships with the community and peers, are affected because of their acceptance of the misuse of prescription drugs. Family relationships could lead to lack of support from parents, along with negative attitudes. It is shown that a history of substance abuse within the family can also lead to the choice of misusing. According to the American Academy of Pediatrics, being in the child welfare system, having a history of mental health disorders, and having negative childhood experiences also attribute to the risk factors associated with substance abuse. Personal negative health effects when using or misusing prescription stimulants can lead to short-term or long-term effects. Hypertension or rise in blood pressure, rise in breathing rate, decline in blood flow, feeling on guard, feeling more excitable than usual, abnormal rise in body temperature, abnormal heartbeat, seizures, potential heart failure or other cardiac issues, feeling deranged or unsound, or the potential use of more substances. There are ways to assist with prevention of misusing. Blueprints for Healthy Youth Development have 2 prevention programs that are both classroom-based. Both program outcomes include prevention of use of alcohol, delinquency, criminal behavior, violence by managing one's own skills, and cognitive behavioral training and awareness and resistance to these drugs. The target population for the life skills training, also known as LST, is 12 to 14 years old, and Project Towards No Drug Abuse target population is between 15 to 18 years old. There are other ways aside from the prevention programs, such as support groups and therapies. Cognitive behavioral therapy, also known as CBT, offers skills training and focuses on current thoughts and behaviors. Multisystemic therapy and multisystemic family therapy both focus with engaging with the antisocial behavior for the child or the teen who abuse alcohol and other drugs. And the multisystemic family therapy is outpatient focused therapy for adolescent and family-based treatments for teenagers. These are my references.